yourself?
I'm from
And that's okay because we're going to be having background noise probably. I'm going to try to introduce yourself one more time and tell us the county that you're with.
this is Beryl Nielsen, and I'm from Napa County.
Great. Welcome, Beryl, and both from Napa County. And then after you introduce yourselves, I'm going to go ahead and mute you again. You don't have space. And then we have Christopher. Christopher's with us. Would you like to introduce yourself, Christopher?
Yes, my name's Christopher Williams. I'm with the Calaveras County Mental Health Board.
Welcome, Christopher. And are you attending with any other folks right now? Or are you,
No, I'm not.
Okay. Okay, now we're going to go ahead and mute Christopher. And Danette, would you like to introduce yourself, Danette?
Hi, can you hear me?
Yes, I can.
My name's Danette Hughes with Kings County Mental Health Board, and I'm the only one here tonight.
Welcome, Danette. Thank you so much for joining us.
Thank you.
And Denise, would you like to introduce yourself?
Hi, I'm Denise Nielsen from the Ventura County Mental Health Board.
Great. And are you attending by yourself tonight, Denise?
I am, but I'm also attending in behalf of my son, McCann, who was appointed with me, and so he's got a class tonight at the community college, but I'm going to report back to him.
Okay, well, great, and welcome, Denise. And Donald, would you like to introduce yourself?
Hello, my name is Don Chason. I'm with the Calaveras County Mental Health Board.
Great, and are you attending the webinar on your own tonight, Donald?
Yes, I'm at my home this evening.
Okay, great. Thanks for joining us. And Greg, would you like to introduce yourself? Okay, we'll assume Greg is not available at his microphone right now. And Irene, would you like to introduce yourself? Okay. And we will have an opportunity during a break time a little bit later on to open up the microphone. So if you're missing this opportunity, don't worry, we will get back to you later on, or we'll create an opportunity. And Guy, would you like to go ahead and introduce yourself to the group? Whoops, I'm trying to unmute you, but I'm having a little bit of a hard time. Okay, let's go on to Jana. Jana, would you like to introduce yourself?
This is Rita, actually, from Calaveras County.
Oh, hi, Rita.
Margot, we're on the phone.
Okay. Go ahead and mute again. Thanks for checking in. We were hearing a little bit of feedback there, so we went ahead and muted you. Lynn, would you like to introduce yourself?
Hi, I'm Lynn Fuller. I'm a member of the Mental Health Board of San Francisco. As far as I know, I'm the only one from our board who's signed up.
Okay, well, welcome, Lynn.
Thank you.
And Marcy, would you like to go ahead and introduce yourself? Okay, we'll come back to Marcy later. And Mike, would you like to go ahead and introduce yourself? Oh, I see Mike has sent us a message saying he's here and he's alone and he's not talking on the microphone right now. Okay, but he did send us a chat message letting us know he's here. Mike Gonzalez from Tehama County. And Sally, would you like to go ahead and introduce yourself?
Hi, this is Sally Ladina. I'm with the Orange County Mental Health Board, and I have Carla here today.
And Sally, you're with Merced?
That is right.
Okay, so that's Sally, and she's from Merced County, and 5 other folks are joining her from her mental health board. Welcome, Sally, and everybody. Okay, so it looks like we'll go back and we'll check with one other person. We have April who's joined us. April, would you like to introduce yourself?
Yeah, can you hear me?
Yes, we can.
Oh, hi, Donna. This is April Waldo, and I'm here to represent the Sierra County Mental Health Advisory Board.
Excellent. Welcome.
And I'm alone. at this current time, but what we've been doing is what I learn, I go back and present to the board,
Okay.
and that
Welcome.
seems to work the best for us.
Okay. All right. Well, thank you all for joining us tonight. So let's go ahead and get started. What I want to remind you about is that on the right-hand side of your screen, you should have a vertical box that allows you to raise your hand. It allows you to have a chat box that you can expand so that you can type messages into me if you have one. You can check off if you have a question, and you can insert the question. So I encourage you all to go ahead and let's just practice with the raising the hand. So if everybody who is attending tonight and is able to operate your keyboard can go ahead and raise your hand, we'll see how many folks are able to use that feature. And what I promise to do is to watch my screen and to see when your hands are raised in case you have a question. Okay, so I'm seeing everybody. Let's see, Don hasn't raised his hand. Greg, Burl. So go ahead and, let's see, let's check in with Don. Don, how are you doing? Are you able to raise your hand? I've opened up your microphone so you can talk with us.
Yes, I just sent you a greetings from Angels Camp.
Oh, wonderful. There it is. Okay, so Don used a questions feature to send me a message. Great. Thank you very much. Okay, and Guy Grenny from Mendocino County. Not sure if you're able to raise your hand or not, but you know, we want to make sure that you're also able to ask questions. So let's see. Who else do we have here who hasn't been able to raise their hand? Irene has a question. So let's see. She's here and she has one person with her, and she's from Ventura County. And Irene, do you want to practice raising your hand? Or we obviously can see that you're asking questions, so that's good. Okay, great. Thank you, Irene. And Jeremy's here from, I believe, Mariposa County. And I believe he's attending with a group of mental health board members. And when they're able to, oh, there we go. Jeremy's just gotten live on here. And Jeremy, when we are able to unmute you, we would welcome hearing from you. But go ahead and shoot me a chat message if you have any questions. And Lynn Fuller and Marcy and Mike and Sally, I don't see your hands raised, but I'm trusting that you know how to communicate with me via the other features should you need to. And Lynn, I see your hand raised. Thank you so much. Okay. Alrighty, so we're going to go ahead and get started. We like to run through that little practice session just to make sure that everybody who's attending is going to be able to, and I see all the other hands popping up. You guys are awesome. But we like to make sure to start our webinars with everybody being able to be fully engaged. And so I really appreciate your patience as we go through that little test period. Now we're going to go ahead and get started, and during the course of our presentation, one of the things we learned last time was that 2.5 hours is a really long time. So we are going to plan to take some 5-minute breaks so that you'll be able to get up, use the restroom, do whatever you need to do. Just stretch, okay? Because we want to make sure that we're maintaining our own wellness even while we're learning so much stuff that we need to know about our mental health boards and commissions. So I'm going to go ahead and get started. You should be seeing on your screen right now the title slide for the PowerPoint presentation tonight. The materials that we'll be looking at tonight were sent out to all those who did register. So if you're participating as a group, they were sent to the person who registered for your group. And they were sent out last night with right immediately after your acknowledgement and reminder to join our webinar today. These PowerPoints and handouts will also be available on the CIMH website, and I can direct you about that at the end of our webinar. Okay, so let's go ahead and get started. All right, let's see. One moment. Whoops. Okay, let's go back. All right, so we want to begin by going ahead and just reminding you about when our next webinar is. It's going to be on Saturday, April 7th, and it will be from 10 a.m. to 12:30 p.m. Don't forget to go ahead and reserve your place if you want to attend that webinar. It will be on dual diagnosis, integrated dual diagnosis treatment. And especially given everything that's going on right now with folks being released from prisons and the realignment effort, there's more and more of a need, as if there wasn't already an exorbitant need, around really understanding what is dual diagnosis and understanding best methods for how to offer services to people with co-occurring disorders. So we really encourage your attendance at that webinar. Next, I also want to just put out a quick shout out in case those of you who are attending need to sign off early for any reason. One of the things I will be sending you as follow-up to this webinar will be, of course, all of the handout materials and PowerPoint again, should you need that. But also, I will be sending out the flyer on the statewide training that is going to be conducted in April, immediately after the CALM board meeting, the Statewide Association of Local Mental Health Boards and Commissions meeting. So we'll be holding that meeting on Saturday, April 21st. It will be at LAX, and this flyer will be sent out to each of your mental health boards. CIMH does have travel funds to support the attendance of one person from each county. Excuse me. However, your county is more than welcomed in sending as many people as you want. We only have a certain amount of travel funds, however, so that may need to be a logistical thing that your county considers. Okay, so as we get started tonight, just again another reminder for those who may not have been on the first two webinars that in participating in the webinars, you've already joined the webinar. If those of you who have called in on the telephone have gone ahead and dialed in, you may be listening to us, but if you haven't activated your audio pin, you may not be able to be fully engaged. So make sure that you've done that. To mute your audio, go ahead and just click on right over your microphone. That will mute you. Should I unmute you inadvertently and you have background noise, that's how you mute yourself. And then you can also see in the column here, I'm going to go ahead and circle the columns right here that I'm referencing. So we see right next to John, there's a column that has a camera. So that shows if you are using a video conferencing setup. However, on your screens, in this first column, you should have that hand at the top of it. And that's where I'm able to see if you're raising your hand so that I can answer your questions. And then webinar etiquette. Go ahead and raise your hand to speak since we have everybody muted because of background noise disruption. It's really important that you either send me a chat message or ask a question through your question feature or raise your hand so that I'm able to unmute you and you're able to get your questions answered as we go. Again, respect and listen with intent to what people say. When we open up the lines, if we have differing opinions, we want to be respectful of the fact that people do have those differing opinions. And speaking from a personal perspective versus speaking for other people. And many of you will notice that the webinar etiquette that we have here is actually fashioned similar to some comfort agreements or some ground rules that groups may use. And these are ones that have been developed in the past for use on webinars. Also, we want to have a limited time for speaking when we have open questions so that everybody has a chance to ask. And as we already said, agree to disagree if there are disagreements. Participants calling in should keep phone on mute when not talking or when they finish asking a question and using the chat boxes to send typed messages. So I see somebody's raising their hand, so let's see who's raising their hand. We'll see how this is working. So let's see, Marcy, I see you're raising your hand and I've opened up your line. Would you like to ask us a question?
No, I was just going to lower my hand. I'm sorry.
Oh, no, that's okay. See, now we get to hear from Marcy because I don't think you were able to introduce yourself during introductions. What county are you from, Marcy?
Marcy Cessna Lopez. I'm the Mental Health Board Liaison to Imperial County Mental Health Board, and I'm joined by the immediate past Chairman, Harold Walk, and our new Vice Chair, Pamela Mills-Morita.
Well, welcome Imperial County.
Thank you.
Okay, we're going to go ahead and mute your line again so that, as I said, we don't have background noise during the webinar. But go ahead and use that raise the hand feature if you need to ask questions at any time. Okay, so advancing on, let's begin. So it's about 5:15 now, so we're actually doing really good in terms of our projected agenda items and where we sit on our schedule for having a webinar from 5 to 7:30. As I mentioned before, we will be taking breaks, and so let's expect to take a break probably about 10:06 or so. We'll take a break. So the purpose of the training today, or the webinar, and those of you who were on Mental Health Board 101, you'll remember that that was a webinar that was on solely roles and responsibilities and then looking at how to conduct effective mental health boards. And you'll see that the purpose of the training today is to review the statutory roles and responsibilities of local mental health boards and commissions, but it's related specifically to the evaluation of services and the annual reports. So don't go running from the room if you were in that prior webinar. We're only going to be reminding ourselves of the statutory responsibilities around evaluation and around creating annual reports. In part, that's to prompt us to remember to do those things, for sure, but it's also a great way to remember about how we explain to other people what it is we do and why we need to be doing that. That it's actually a statutory requirement. We're also going to be providing practical strategies tonight for how to evaluate mental health services and how to produce an annual report. And then also just looking, seriously, when we were creating, and I tend to be very casual in how I speak during these webinars, so I hope that will just set the context for what you can expect tonight. But quite frankly, if you look at the third bullet here, increasing local mental health board and commission success in reviewing, evaluating, and making recommendations, that is truly the purpose for all of our trainings. Trainings are not so much a time of telling people necessarily what things may be going on that are being done wrong, nor is it a time when we expect that you don't know anything about a particular topic area. Rather, we're looking to increase your success at doing what you're already doing. In traveling around the state, I've had the pleasure of meeting many of you, and I will tell you that I have the utmost admiration for the services you're providing to your communities, so thank you. And then finally, the purpose for the training tonight is to highlight also the benefits of partnering with local mental health departments and community. Now, again, that's not to say that you're not already doing that, but with regards to evaluation of services and annual reports, it can be also invaluable. So I'm going to go ahead, and what I do is when I'm actually conducting the webinar, just to let you know, and I'm presenting materials, I will oftentimes close my panel if you have your hands raised. And so at the end of each slide, I will always make sure to open up that panel to make sure that we're attending to all of your needs. Okay, so we're going to go ahead and move on. The training objectives. Specifically, we've talked about the general purpose of the training, but the specific training objectives that we hope that you'll be able to accomplish as a result of attending tonight, and we're going to ask for your feedback and a pop-up evaluation at the end, a very short pop-up evaluation, by the way, is to be able to describe the three primary functions of local mental health boards and commissions, and that's just always a great reminder for folks. To identify two key strategies, at least two key strategies for evaluating mental health services, to be able to describe three basic components. There are more components for different mental health board annual reports, but to be able to describe at least three components that you would want to have in your annual report. To define the value, to creating a board work plan, to develop a sample work plan, and to consider how you would draft a sample recommendation that would be included in an annual report for your board. And as we go on, we'll definitely flesh out more of these, but let's start with these for right now. Actually, I think that what I want to do, let me back up for just one moment. I want to go ahead and ask you, those are the training objectives for tonight. I want to hear from any of you who may have other needs that you're bringing to the table around the evaluation of services and creating annual reports, that we make sure that we're including maybe some specific needs that you may be bringing to the table with you tonight. So I'm going to go ahead and pause for a moment, and I'm going to ask you to raise your hand if you would like to volunteer what you're looking for in particular tonight. I'll just give that about 15 or 20 seconds, and we'll see if anyone has anything that they'd like to contribute. So thinking to yourself, even if you don't have something to contribute right now, just think to yourself, what do I really want to be taking away from this webinar tonight around evaluation of services? What may I want to be learning tonight? Or what may be most beneficial for my board to be apprised of so that we can be most effective in doing the evaluation of services and programs, but also in being able to then report out on our activities in an annual report. Okay, and I see that there may be one question here, so just a moment. And we also have, I just want to mention to you as well, let's see, okay. We do have a question, okay. So I'm not seeing who the question's from, but I'm seeing that we have a statement. I'm about to go out and review programs for the first time. I have no first-hand experience of programs, and I'd like to know what to look for. Great. We'll definitely address that issue tonight for you. Okay. And is there another question? I'm also wondering how mental health boards should review and determine the efficacy of programs in a big picture sense to make sure that public funds are well spent. And we can talk more about that towards the part where we're actually talking about specific strategies. One of the things that we'll be doing tonight, and thank you for those two questions, is talking about why we're doing what we're doing, generally how we can approach doing it, and then we'll look at some specific strategies and examples. So for instance, we have a sample checklist on doing site evaluations and program evaluations. And part of what your board may consider is, just like these individuals were mentioning what their concerns are in going out and evaluating programs, or in considering the bigger picture issues of, is the money spent on these programs well spent, the bigger picture, et cetera, is how, when you're conducting your reviews, you may be utilizing a number of different ways of gathering the information. So it may not be that you get all the information that you want to answer those questions in a site visit per se, but you'll get some of the information, and we'll discuss other ways to get the rest of the information so that you have both the small picture as well as the big picture. Okay, so let's go ahead and move on for right now. And so setting the context for the local mental health board, and I do this again not to detract from the topics that we're here to talk about tonight, but because it's important that in the midst of everything that we're doing right now, or that you all are doing as local mental health boards and commissions, there's a lot going on dynamically around the state in terms of our statewide structure and how that impacts our local mental health boards. So I contribute this tonight in order to help you see the context for how your local mental health boards and commissions are operating in, and because those things then may impact not necessarily what you're doing at your local level, but the imperative and the importance to what you're doing at the local level. So let me just go ahead and proceed, and it will become a little bit clearer what I'm talking about. So statewide structure. So again, those of you who have been through the webinar on Mental Health Board 101 will recollect this diagram, where we look at where the local mental health boards fit in the overall mental health structure of the state. So you see currently right now we have the State Department of Mental Health on the left-hand side, and we see that drop down below that is our local mental health department, right? So our local mental health department receives funds directly from the state, and there's an accountability stream right now between local mental health departments needing to be in communication with the State Department of Mental Health around receiving funds, submitting plans, that sort of thing. We also have in the center of our diagram the local board of supervisors. And we also understand that they are also have an obligation between the State Department of Mental Health, as well as we see the connection between local boards and the local mental health department. We know that the local board of supervisors actually has authority over the local mental health department and hires the mental health director. We also know that the local board of supervisors is the appointing body to our local mental health board. So we see how those authority structures work and what those avenues look like. Similarly, between the local mental health department and your local mental health board or commission, we don't have an authority structure per se between the two of you. Rather, you have the opportunity to operate in collaboration with each other in your reporting to the Board of Supervisors about what the duties are that you've been charged to do. And then we'll see, though, that in the next slide, with the shift in what is happening, that now what we have, here, let me just back up for a minute because I kind of jumped a little bit. So here's where I was just talking about, where we still have the State Department of Mental Health on the left-hand side. We have the local board of supervisors in the middle, and then underneath the local board of supervisors is the county mental health department and the local mental health board. So right now, as your boards are going out and evaluating programs, you may be collecting information from the mental health department to help inform those evaluations. Ultimately, you're reporting to your local board of supervisors through your annual report about what your findings might be. Those are the people that you're accountable to. Conversely, the local board of supervisors and your mental health department then are accountable to the State Department of Mental Health, and that's the current structure. Now we look ahead to after June 30th. At that time, the Department of Mental Health will have dissolved, since that is what the governor has set in motion. And what's going to be happening is your local mental health departments and most mental health and MHSA services will be falling under the auspices of what is the Department of Healthcare Services. So again, instead of the Department of Mental Health, now we're going to have the Department of Healthcare Services. However, as this diagram shows, there's a dotted line now between the Department of Healthcare Services and your local mental health departments. And that is because there will no longer be a state agency overseeing and approving local mental health plans. Those will all now fall solely to your local board of supervisors to approve, and there will be no statewide oversight of that function. So that strengthens and makes more important what happens at that local board level. Similarly, that will then also, let me back up for a moment. That will similarly strengthen and make more imperative your role as local mental health boards, because there will be no one at a statewide oversight to be saying, you know, your board of supervisors approved a plan, but it came to us, and you know, we may think it's great, or we may think that there is some need for improvement. There won't be that anymore. The state will be operating and looking at outcomes for sure on the back end, but there will be no front end oversight as to what your counties are allowed or not allowed to do. So that will rest solely with your local board of supervisors. For that reason, your ability to influence and to advise and make your recommendations to your local board of supervisors becomes more important. So, and again, the review of the statutory authority and duties that we have or that you have as local mental health boards, a reminder that they're outlined in the Welfare and Institutions Code section 5604.2. And that again is a code that we went over in great detail in Mental Health Board 101. We went through each of the roles and responsibilities specifically and in great detail. For the purposes of today, we're listing all of those roles and responsibilities, but as you see in the blue font on your screen, I'm going ahead and just calling out 3 of them as they relate to our training for tonight. So as a reminder, and again, this is so that, especially if you're a new board member or you're not used to, or maybe you're not as familiar or comfortable in explaining to other people, why is it that you're doing that? And, why are you going to programs again? You're not a clinician, or, what is your purview? This is to give you that solid foundation of understanding why you must be out there evaluating services and programs. So the statutory law specifically states the local mental health board shall do, not may do, shall do all of the following. And for the purposes of tonight, I'm just going to go ahead and read out the ones that are in blue that are relevant for tonight. So number 1, review and evaluate the community's mental health needs, services, facilities, and special problems. Now, the special problems, that can probably be something that is self-defined at your local level. We'll all have different situations that may arise from time to time, and that may go ahead and fall underneath special problems. But in terms of this reviewing and evaluating needs, services, facilities, that's a mandate that you have according to the statute. As well, you have the mandate to advise the governing body, your governing body, whether that's your board of supervisors, or some of you are not in counties, some of you may be in a couple of the city bodies, the city of Berkeley or Tri-Cities, in which you have your own governing bodies. So your duty is to advise your governing body, whoever appoints you as local mental health boards, and the local mental health director even. Not that you have authority over either one of those bodies or individuals, but you are obligated to advise them about what you are learning and what you know to be the needs and the needs for services and the efficacy of those services and facilities and programs. So you're charged with advising the governing body and the local mental health director as to any aspect of the local mental health program. Okay? I'm just going to pause for a moment and look over and see if we have any questions or any hands raised. Okay, so I'm going to go ahead on. So the other thing I want to remind you about is, again, according to statute, you have the obligation to submit an annual report to the governing body on the needs and the performance of the county's mental health system. Now, does that, for those of you who are thinking, oh my goodness, our county has a number of different programs, a number of different services for children, for adults, for older adults, for transition-age youth, your mind can go wild thinking about all the different ways our county departments of mental health or behavioral health are actually operating. There's so much that is being done on a daily basis. However, you are charged with setting some reasonable goals and providing a report on the performance of those that you are evaluating in that given year. And just as a reminder, this isn't in blue, and this isn't necessarily particular to what we're talking about tonight, but because of the realignment of with AB 109 and the release of, or not the release, but the return of folks who normally would be sent to prisons to county oversight, if you will, we need to, as mental health boards and commissions, assess the impact of the realignment of services from the state to the county in terms of how that impacts mental health services. So if there are questions about that more a little bit later, we can talk about that. Okay, so primary functions, again, just sort of like as a review, and this is as a review of the general roles and responsibilities, as a mental health board are to oversee and monitor the local mental health system. That's why you were appointed. That's what the charge of mental health boards and commissions is. And to advocate for individuals with serious mental illness. And there are a variety of ways that you can do that as a mental health board. As we just mentioned a minute ago, provide advice to the Board of Supervisors, that's BOS, and the local mental health director. And also, see here, the next one, the fourth bullet, ensure the development of improved services, access to services, and the best mental health programs possible. That's where, when you're out there and you're doing your evaluations, The thing to be always mindful of is to, as you're going out there, as you're first going out there, you may have a whole checklist about what you want to know about that program, but something to always be thinking about in the back of your mind is, when I walk out of here, is there anything that has stood out that needs follow-up? Is there, I don't know, a lack of parking, so that, you see that there's, people double parked everywhere, that there is, inappropriate physical access to the facility. Is everything going really well? And you want to, and you think, I continue to be impressed by the type of services I'm seeing being offered, and we need to ensure that this type of program continues. Those are the kinds of things to be thinking about when you are doing site visits or doing evaluations of programs and services, because that's where your advisory capacity as a mental health board comes in ensuring the development of best services. You have the opportunity to be thinking about that on your site visits. Is this a site that could use some support, or is this a site that has a lot going on that could be a model for others? And so, but the primary function, so if you were out in your yard in the morning and your next door neighbor came over and said, I heard you're on the mental health board, so what exactly do you all do? And you needed to give a quick answer before you finish doing what you were doing, your answer could be, I review, I provide evaluation, and I make recommendations on how to improve services or how to have the best services for people in our community. And so reviewing the services, evaluating the services, and making recommendations about how to make improvements, those are the primary functions of your mental health board. So I'm going to pause for a moment. I'm going to take a little drink of water, and I'm going to look and see whether or not we have any additional questions. Okay, and I've noticed that Betty's joined us, so I'm going to put Betty on the spot, and a couple of other people have joined us. Betty, would you like to introduce yourself?
Yes, my name is Betty Jo Dickey, and I'm on the Fresno County Mental Health Board, and I really appreciate this particular offering that the webinar is giving, and I really have been forwarding the other programs that the CDs that you have sent us, rather over the internet, the programs that you've sent us, the listings and the information, I have forwarded those to every member on our mental health board. And I think that they're glad to get it. I don't know how many will read it, but since it's quite lengthy, but it's good to have the information, and I thank you for that.
Absolutely, Betty. Well, welcome tonight.
Thank you.
And Betty, I'm going to go ahead and mute you again now, as
Okay.
I have other folks, because that allows us to hear folks better by reducing background noise. So thanks, Betty. And I see a couple of questions coming in, so just a moment, and I'll get to you. I see that David has joined us, and David, I wanted to yourself. David, would you like to introduce yourself? Okay, and David may not have the ability to introduce himself right now, so I'll go ahead and mute him. And let's see. And I see James Kavanagh has joined us. And James, are you able to introduce yourself?
Yes.
Hi, James.
Can you hear me?
How are you?
Yes. Doing well. And you?
I'm good. Would you like to tell everybody what county you're from and if anyone has joined you in participating in the webinar tonight?
I am by myself, and I'm on the board in Siskiyou County, and I'm our regional coordinator for the California Association of Local Mental Health Boards.
Great. Thanks, James. And James, did you have a question?
I did. Do you see?
Go ahead and ask it.
Okay. I have been learning from others about the site evaluation things, and realize that really our board in my 4 years with it, has done very little of that, and we're talking about needing to do that. What I'm concerned about is because our local mental health program, which has gone through some great transition lately, some tough transition, and our director are not used to us offering that kind of role. I'm just curious if anyone has any advice on what maybe we can give them as far as information written or whatever to help them understand why we want to do that now.
So you're asking for feedback about how to shift their expectations of how you're doing evaluation as a board?
Yes.
Great. And I'm going to look to see if anyone else is raising their hand to see if they would like to answer that question. And I'm not seeing any hands raised. So just a moment, please. So one of the things I actually would like to, I'll go ahead and give you a short answer to that. And we can definitely entertain this throughout because I think that that is a huge, not a huge, but I'll say that that is a key point that you're bringing up in terms of the expectations and the historical ways that different boards and commissions have operated. I was just speaking with a retired mental health director the other day, and I was talking just about this very issue, and that person's response was, oh, no, mental health boards don't go out to the programs. And I think that both in turn, there's no, first of all, the answer is there's no reason not to, but there's nothing explicitly in the statute that states how you must review and evaluate. And so it ends up being up for interpretation. So what I would coach you to do is, and what's part of this conversation tonight, this webinar tonight, is how to develop a partnership so that you're educating folks about, including your mental health directors or your mental health department, about why you want to go out there, finding out what their concerns are, showing the respect for client privacy and HIPAA and all of that kind of thing. And so actually having a conversation about the process of how to do evaluations if you're finding some sticking points. So part of what comes into play then is not so much the what you're doing, but how you're doing it. And you have an opportunity as mental health boards, both in if you're expanding your role and how you do evaluations for the first time, as well as if you are working with mental health directors or county staff who are not used to mental health boards working in that fashion, you have an opportunity to be looking at your relationship building and how you're doing relationship building with them, because you always want to be trying to operate collaboratively. And so you need to, you know the expression, pick your battles. I'm not saying that this would be a battle per se in terms of a negative, but in terms of looking at where you need to take on the challenges of growing with your mental health department in terms of understanding how you're going to execute your roles. You may think about how can we do this so that we're actually not just getting to do evaluations of programs, but we're developing a trusting relationship with each other because we're going to need each other over the long haul for a lot of different reasons. So that doesn't specifically answer your question about how to do that, James, but I think that it points to the opportunity to not just look at it as a limited incident of how do we do evaluations, but rather how do we develop that trust and that collaborative approach to getting our work done. Does that help at all?
That helps a whole lot.
Okay. And so, and there's, my belief is that there's nothing wrong with just being completely honest. And so, in part, that's why I provide some of the statute history, the background on the statutes, because you can see that it doesn't say not to do something, but it doesn't say that you should do something explicitly a certain way. And so that might be the starting point for how you have a conversation with administration or management that's not used to having things done in a certain way. And sort of just be quite frank in saying why you want to do it, because you want to see, and remember when, as advocates, many of us I know come from an advocacy background, maybe community advocacy background. And so it's not about going out to find fault. It's also going out to find what the solutions and the models for what's working. So sometimes if we can remember to frame those things as well, we build those relationships easier or quicker with folks. So let's see if there are any other questions right now. Let's see. I see that Donna is saying, and James, I'm going to go ahead and mute you now. I see that Donna is saying the upcoming role is well beyond oversight of MHSA funding and projects to overall systems. Let's see where Don is, and let's unmute him and see. Don, are you able to give us a little bit more information about what you're talking about in your comment?
Yeah, just from the general question of the overall system performance seems to be a much larger purview than just the particular funding projects of MHSA funding, those particular projects.
Right, right, and that's actually a great point, and I appreciate you bringing that up. So thank you. So let's see, any other questions? And Lynn is saying, I'm also wondering how, okay, and I think that we had talked about this before. She had said, I'm wondering how a mental health board should review and determine the efficacy of programs in a big picture sense to make sure that public funds are well spent. And I think that let's go ahead and address that right now, and then we'll start to move on, because I know that time slips away, even though it seems like it's going to be a long time, 2.5 hours. If you look at your clocks, we're already 45 minutes into it. So the bigger picture is that's going to be where, again, and we'll look at some sample evaluation forms that you can use, that as you track your evaluations of different programs, you may then create an opportunity in your mental health board meetings when you're reporting out on your site evaluations to be reflecting on just these things. I'm sure that the public is also wondering those things, and so it's a great issue to be reflecting not just on again the short term or the small picture of a program, but looking at that big picture of what's the impact or what's the benefit overall in our system, in our county. And that's something that can only really happen on that local level. Okay, so let's move along now. Evaluating mental health. Well, actually, I would like to make a suggestion. And the suggestion is that we're about to get started on the Evaluating the Mental Health Services and Programs section. However, we've just had a lot of conversation, and it's about 45 minutes in. I'm wanting to see by a show of hands if anyone actually needs a break yet, a 5-minute break. And if not, I will just encourage us all to do a big stretch, and then we'll move on. Okay, I'm doing a big stretch, and we will move on. Whoops, I do see a couple more questions. Let me just glance real quickly, folks. And I see Julie Crouch has joined us from Riverside County, so welcome, Julie. Okay, now moving along, evaluating mental health services and programs. So the first thing that we want to do before just jumping into evaluating the programs, and I'm going to go a little bit quickly through this because I do want to make sure that we have adequate time for the full presentation. But I want to make sure that you go ahead and raise your hand if you do have questions and you need me to slow down at all. So the first thing that we're going to talk about is identifying goals. Before we start jumping into programs, I mean, we could start jumping into programs, but it begs the question of which programs, right? So part of getting organized is starting with identifying what your goals are, and then assessing needs as you need to, and then evaluating your programs, right? So even though our webinar tonight is on evaluating programs, it's important to note that if there isn't some of this preliminary work that has been considered, you may not be as effective in having a clear, transparent process for other people about why you're choosing certain programs to evaluate. So let's go ahead and look at the identification of goals for the board. if your board has not created goals, or if you're about to create goals, or if you're kind of rethinking your goals, we're remembering that goals are what creates a focus for the board, or for any of us for that matter. When I get up in the morning, the thing that makes it easiest for me to get into the office and to start working is to think ahead of time, what are my goals for the day, right? So it's something that's simple. So it doesn't have to be a complex process, but it needs to be a thoughtful process because it'll help to establish annual expectations for your board. It can translate that into an annual work plan that you create. And it gives everybody an understanding, including the public, about why you're doing what you're doing. So if your board has annual goals, do they suggest specific community needs to assess? So in other words, and we'll get into some of the examples in a moment. Similarly, do the goals indicate specific mental health services or programs to evaluate? Maybe your goals for your board somehow are already indicating to you what those things are that you need to be targeting. And if not, if your board doesn't have annual goals, is there a way to create goals even just around the, identifying needs and services, even if they're broad, just again, so people have a context for knowing why are you doing what you're doing if you're going out and evaluating services and programs. Examples of goals, specific goal, evaluating the support services for youth. I was meeting with one mental health board a couple of years ago. They were doing an annual retreat, and they were talking quite a bit about the bullying that was going on in their local schools. And so, you know, one of the focuses that they had was on making a determined point of creating a committee, and then looking at support services that are available for youth. That it was unacceptable and had gotten into a real critical place in their community about the situation of what was going on for some youth in schools. Likewise, there can be a broad goal, and that can just be identifying what programs exist for addressing mental health needs for any community, right? Whether that's an ethnic or cultural or socioeconomic. We know who's that may, to some extent, be determined in terms of who qualifies for our services, but also different age ranges of folks or different parts of our county. Some of your counties are rural, some of them are very highly urban, some of you have a mix, some of you may have English-speaking communities, some of you may have Spanish-speaking communities, etc. There's quite the diversity of linguistic, of different linguistic competencies or abilities in different communities in our counties. So there's a number of different ways that we could establish a broad goal to identify what programs just simply exist, to do an inventory, and then to maybe identify what we're going to evaluate according to that. So once we've identified goals, then how do we start assessing needs? So again, we may have a goal, but is anyone saying that they actually have a need around that goal that we've identified? And so that's a really important next step to just make sure is in place. So when we're going on assessing the mental health needs of the community, again, just like the establishing goals, gives people a clear understanding about why we're doing and it legitimizes what we're doing. So it also creates a basis, as we see here in the first bullet, a basis for prioritizing what services and programs to evaluate. It creates a venue for learning what we don't know yet by assessing the needs. And it assures that we understand the needs. I, several years ago, had done quite a bit of work in schools, doing what was called Safe Schools work at the time. And that was around ensuring that lesbian, gay, bisexual, and transgender students were not we're not being bullied and harassed, but more importantly had access to an equal education, which is the requirement according to law. And so, and however, now 6 years later, that doesn't necessarily mean that I still understand the needs of that community, right, that youth population. And so doing needs assessments are important, that even if we think we have experience, how current is it? How relevant is it for an entire community of who we think we're representing, right? And And again, probably most important, well, not most important, but very important, is this last bullet. When we assess the needs, or we ensure that we're being informed by the needs of the community from the community, then it creates real transparency, and we engender trust from our community that the job that we're doing is relevant to what they need and to who they are. And so how might my board assess the mental health needs of the community? Well, some of you have held community forums. Some of you hold annual forums, just town hall meetings, so to speak. I've also been privy to working with some counties on conducting community surveys around different things. When some of the planning process has been going on, we all know some of the Mental Health Service Act programs in particular, because that engendered or encouraged such a strong and required such a strong stakeholder input, it gave us a real opportunity, as we all know, for really getting quite a bit of input from our community about what is needed. We can also assess the mental health needs by conducting focus groups. We might review data. We might not have to actually engage with doing the work of the needs assessment ourselves. One of the benefits to a lot of the work that's gone on in our counties over the past several years has been the accumulation of a lot of data about what different groups need. And so sometimes it may be as simple as looking at some of the data that has been collected, right? And so just reviewing that community data. Similarly, reviewing already gathered information from other needs assessments. And finally, and this is something where we go back to James's question about what if you have a mental health director or a department that's not used to having your mental health board act a certain way, right? Many boards also have the benefit, and many mental health directors and county staff have been very good about providing information to their boards, presenting reports, giving accounts about what the department is doing. And so that is always a fallback, not a fallback, but a primary source of information that can both support your site evaluations as well as kind of give you that bigger picture about what's going on in your county for different groups, or how certain services may be being effective or not. And so, and after I do this particular slide, I'll stop and I'll see if there are any questions. So if you have some questions, don't worry, I'll get to you in just a moment. So some examples of assessment strategies for doing a needs assessment. If as I'm going through the importance of a needs assessment and hearing from the community about what their needs are and having a legitimacy for why you're establishing certain goals for your board, some of the things that have been done are creating an ad hoc committee just to plan a needs assessment strategy, or to identify what may already exist, collect the information, so to speak. Some folks, as I've already mentioned, some county boards and commissions have conducted their own town hall meetings, kind of just an open house, you know. What are the challenges and opportunities or needs of the community? Reviewing MHSA stakeholder meeting reports, another great example that I had just mentioned as well. And the presentation of different reports. The performance report is usually the report at the end of the year that the mental health director will be doing regarding their accounting of the performance of your county. Also, cultural community focus groups to assess access to services, for instance. Sometimes that can be very helpful. So in terms of, excuse me, I need to take a little sip of water. So in terms of sometimes how we all get brought on in terms of representing different groups, whether we are representing the at-large community on our board, or we're representing consumers or family members, or maybe different cultural groups. It's important to also be paying attention, as we all know, to when people aren't being included, or when they're just not being heard from, or somehow where the data is not reflecting it, right? So sometimes we can also be doing needs assessments of the people that we're not knowing anything about and that we notice are not being included. And examples of that might be that sometimes when we're doing a look at paying attention to the needs of different cultural groups, racial or ethnic or cultural groups, we may forget that there are so many subgroups within each different group, so to speak, that sometimes gets labeled. And I remember working on a needs assessment once and thinking about the Latino community in one county. And then becoming incredibly aware of the fact that the survey that had been developed in English, and that while a good part of the Latino community may know English, the migrant worker community may not know English as readily. And so thinking about subpopulations of groups, and that's just one example, right? So thinking about the people that we're not getting data on or that we don't know what their needs are, equally important in terms of maybe how we identify assessing needs. So I'm going to go ahead and pause for a moment. I'm going to go ahead and see if there are any questions. Questions coming up? Okay. So we will move on. Okay, oh, look at that. Next slide, stretch break. So I think that what I'd like to suggest that we do for this moment, it's about 5 after 6, is I would like to encourage us to take a 5-minute break. I would like to encourage us to stand up, stretch, walk around for a moment, get a drink of water, do whatever we need to do. I want you all to be with me for the next hour and a half, so I really encourage you to take this little break. And for those of you in groups, talk amongst yourselves about the information we've covered, and please feel free to come back with questions, and we'll check in and see if you have questions before we get started. So we're going to break right now. We're going to go ahead and be back at 6:10, and then we'll get started on the next section of the webinar.
muted.
Okay, we're going to get started again. We're going to start with questions that I saw come in while we were on break. And so I'm first going to go to Betty. And I think Betty might have had a question regarding the site visits. And Betty, I'm wondering if you're back with us from break.
I am back. Thank you. Can you hear me?
Hi.
Hi. I'd like to go back to the information on the site visits. Fresno County is beginning to go on site visits, and we will be going on our second and third visit next week. And one of the questions, I would really like to know is from the supervisors and directors of programs is maybe what are your biggest challenges? And I'm afraid that that can be threatening to the individual because they may think that information is going back to the higher ups, and they want to appear to be in charge of everything. And so I would like to know how you would present a question like that so that it would not be so threatening.
And Betty, you're fading a little bit on the phone, and so I'm going to go ahead and repeat what I heard from you, and you can let me know if I got it right or not.
Okay.
That you're in your county, you've been going out and doing several site visits already, and part of what you'd like to learn in your site visits is what are the challenges that maybe a program director or a clinic director or whomever is having in that particular program or service. Is that correct?
That's true.
Okay, and then you were also asking about how other people, or how to actually ask that type of a question so that it doesn't seem threatening, or that the person doesn't need to be concerned about word getting back to their department, that they've expressed those challenges.
That's true. Thank you.
Okay, and so I'm going to go ahead and look. I'm going to go ahead and look over at our attendees and see whether or not anyone else would like to actually respond to Betty's comment about how to ask people about the challenges during site visits without it seeming threatening or without them needing to worry about it getting back to their departments. And I'm wondering if anyone else has any solutions to that particular issue. I see Julia Moore has raised her hand. Julia, did you have something?
Actually,
do you have something to offer?
No, I couldn't hear Betty at all.
Okay, did you hear my repeat of the question of what she was asking?
Yeah, but that's when I sent the question in to you, hon. Now I'm still on. It says stretch break, and then it goes to download complete. I'm not picking up your webinar anymore.
Oh, we're still on. Actually, I have not moved the slide, so my apology. So let's see. Do you see the slide change there, Julia, and everybody else?
Yes.
Okay, great. And then
I think I'm I'm back to the same page that you get that it says download complete. Your webinar session should start in a few seconds. So I don't know. Just I'll listen to you.
Yeah, and you know what else? And I want to
feel free to mute me now.
Yeah, I'll go ahead and mute you. I want to invite other folks to let us know, let me know, and let the group know if you're having some technical problems, because even if we can't assist you in the moment, it's important for us to know about the challenges that may come up during these webinars so that we can prepare for them either for the next go-around or see if we can support you right now. So one of the things that I would suggest to Julia might be to see if in some way you inadvertently reduce the screen and the webinar just is down in your bottom bar. That would be one option. And then the other option would be to actually reinitiate your participation in the webinar and then have the webinar re-engage. So I'm going to go ahead and ask Julie Crouch. I've unmuted you, Julie. Did you have a thought about what Betty might be able to use as a strategy on her site visits?
Yeah,
And Julie, can you speak up?
Oh, wait, let me play with my, is this better?
Yes, it's much better.
Okay. I'm in Riverside County, and we've been doing the site visits for years. And the way I go about it is I go in to make friends with the person that's taking me around. And I don't ask them, you know, what are your challenges? I ask them what their needs are. Do you have some needs that maybe I might be able to help you with? For example, I went and did a site visit at one of our clinics, and they had moved in there. They've been there about 6 months. There were still no signs outside. You didn't know where the place was. I myself got lost getting there. There were no numbers on the doors, so people would know what doors they were going into in the offices. And so those are the things that I took back and reported on to my mental health board. And in response to that, they got their sign out sooner than, you know, I mean, it was done within the next couple of weeks. So if you just make friends with them, talk to them like you're, you know, and then ask them what their needs are, because sometimes it's the way you phrase the question.
And Betty, you're still unmuted. Does this sound helpful at all to you?
Yes, it does. It sounds very helpful. And
Okay.
we have that opportunity, you know, to meet some of these people during the regular board meetings, and it's helpful if we've already established some of that friendship level. And certainly, I think we should be open to whatever we see too that needs addressing, and to help them get those needs met.
Okay.
I just would like the directors, you know, to feel comfortable. And it's a big deal to have people coming for a site visit, you know, and so I'm looking for something, and I think changing the way we address it too is very helpful. Thank you.
So, and I'm going to just repeat what Betty said real quickly, because I know it's difficult for some of us to hear her, and I know some people chatted in that they were having a hard time hearing her. And so, Betty, and that's nothing on you, sometimes it's these connections we've got. So it sounds like that was a helpful comment that Julie made about, you know, asking people more about what their needs are versus what their challenges are, and just also kind of trying to do whatever it takes to make it seem less intimidating, because sometimes having a site visit by somebody can be difficult. And so then I would also encourage you, Betty and others, that as someone who once worked in a clinic and used to have people coming through on site visits, it was really helpful actually sometimes hear from those folks about what are you going to do with the information, you know. So to go back to one of the things that you had asked about initially, Betty, which was what if they're worried that you're going to take the information back to the department? Well, you know, one of the things that can assure people is certainly you can't dismiss something as being connected to a particular site if you're trying to make a connection to do a site visit evaluation. But there are ways of generalizing it and reframing it so it doesn't seem like it came from one person, if possible. So I think the other thing that Betty remarked on was the establishing of relationships. And just like we mentioned before about establishing relationships in order to get your work done with your mental health department and your mental health director, similarly, sometimes on site visits, it can be something as simple as maybe you ask them when you're confirming your appointment, you ask them, is there anything that we can be prepared to share with you? You know, maybe they just even want to know when your mental health board meetings are. And so you can come prepared to also give something to them as well. So just some ideas about creating that kind of non-threatening, collaborative relationship with folks. Okay, any other questions right now?
Just a comment, Donna?
Sure.
Also, if you're doing the same site every year, which is what we normally do, you get to know these people, and so you do develop that relationship with them. And I usually go into the first time site visit and say, you know what, it's really painless. I have just a few questions. Just walk me around and show me your clinic or whatever.
Great. Good suggestions. Okay, so let's go on, and we're going to be able to get into the heart of the matter of evaluating programs. So now we're moving on, and we're looking at in reviewing and evaluating public mental health services. Again, remember, we're basing this on what our board goals were for the year, or perhaps committee goals, if a committee has been charged with coming up with particular goals around reviewing and evaluating. We're connecting them to an assessment of needs that may exist. And we're creating a work plan to review and evaluate services. And we'll talk more about that in a minute. And most importantly, as we've already mentioned, working in collaboration and initiating a collaborative relationship with the county mental health director can really be invaluable. And again, just like we're talking about people on site visits sometimes feeling threatened by what it is we're doing, I think similarly in some counties, just like some workplaces, just like some people, you know, we are not absent a history in our community, and in some communities there's been difficulties, whether it's in services per se, mental health, or what have you, and so sometimes there are reasons that people have a fear, and so all the more important reason to look at how to create a collaborative relationship, to kind of bring the person in, so to speak, and I'm using this analogy figuratively, but to kind of confide in them. This is what our plan is. This is why we're going to do what we're going to do. How can we work together with you to be able to review and evaluate some of these programs? Seems really important right now, and for us to be able to do our duties as mental health boards. So, and doing that on the front end before you make your announcements about where you're going to be doing site visits. Okay, and again, evaluation strategies. How to evaluate public mental health services. Remember, you know, part of what some mental health departments and some mental health directors and some people in general like to do is, if you have a certain, think about it, if you have a certain responsibility for something, you like to be able to be the person to present what those services are doing and how effective they are, that there's a lot riding on it, right? Both in terms of job performance and also in terms of showing that you're also competent at meeting people's needs in your community. And so as a mental health department, part of what you can do to establish that collaborative and trusting relationship is also to honor the work that's already been done. So while you're doing site visits, you also want to be looking at any outcome reports, any prior reports regarding program performance, so that you get the background on what the county already knows and has presented about that. And then you can explain a little bit better what you're going to be looking for in the site visit evaluation. And then are there any other strategies that people have used? Now, Julie has volunteered about how she conducts site visits and some of the tricks that she uses in site visits in Riverside County. But I'm just wondering, are other folks in other counties, have you explored other ways of evaluating services in your communities? Okay, and so.
Well, Donna.
Yeah, go ahead.
Riverside County, every mental health board meeting that we have a presentation brought to us from one of the programs. You know, be it PCIT has come in and done a presentation, patient advocates have come in and done. So every board meeting we have one of the programs come in and present to us about their program, and that way the whole board knows.
Mm-hmm. That's good. So that's another strategy. Okay, so let's move on. Let's look at how, well, we were just discussing this, how our mental health board or commission currently evaluates services. I want to ask the group to go ahead and use your raising the hand feature, and let's see how many people who are attending tonight. We have 22 people on the line right now, which doesn't include the people who are present in groups. So let's go ahead and see by a show of hands how many people have actually conducted a site visit in a program or service. I see that Burl has, and I hope it's okay that I'm using people's names, and Danette, and Irene, and James. And so I'm wondering, okay, I'm going to go ahead and put your hands down for you now. Go ahead, whoops, Burl's hand is back up. I'm going to lower it. Go ahead and raise your hand if you would like to volunteer, if you would like to be unmuted and tell us a little bit about that site visit that you did. What did you find when you went out on a site visit? Was there anything surprising that happened? Was there anything that you thought made it more effective in conducting your site visit? Any input at all? Okay, Burl. What was your experience in conducting site visits in Napa County, right? And Beryl, are you there? Okay, and it seems like we're having a difficult time hearing from Beryl. And I want to encourage people that if you are having any microphone issues, that you can go ahead and use the chat box to go ahead and send your comments in, or use the questions feature to send your comments in, and I can go ahead and read them aloud for the group. So there are multiple ways that you can share your information if you'd like to. Okay, so let's go ahead and move on for right now. So the must of site evaluations. Again, and I'm sure Julie, since Julie has done quite a bit of stuff down in Riverside, it sounds like Julie's been the queen of site visits. And that's kind of an interesting strategy, Julie, what you shared with the group about the fact that you go out and you evaluate certain programs every year. That's an interesting strategy for just seeing how things change over time as well. But most of site evaluations, you want to prioritize how many sites you're evaluating as a board or as a committee, and targeting those that are addressing goals or needs. Again, as much as you can make linkages between what you're doing, it's going to not only make more sense to the community in watching the actions of the board, but it's going to kind of give you that basis for being able to explain, perhaps in an annual report, just saying, why it was, giving that full picture of why you went to different programs and why it's important, the recommendations you're making, because they're linked to needs that you know exist. Also, determining the capacity of the board to do evaluations. I'm not sure how many people have sat around in a meeting and felt that you all wanted to do such a good job, and then at the end of the meeting you realized you were walking away with so much work on your plate. Now, I don't know, maybe call that just, you know, the experience I've had, but what we want to make sure to do as mental health boards is maintain our own wellness, right, in the process of all of this. So determining our own capacity to do a certain amount of work is really important for a couple of reasons. One, it's manageable. It allows us to do things that are manageable. Two, it lets us know by virtue of setting limits about if we need to increase our capacity. Maybe we actually need to put a little bit more work in membership recruitment because we actually would like to do more either evaluations or other types of activities. But it also, again, in determining the capacity of the board to do the evaluations, it really also looks at the workload issue, that there are also some boards where certain individuals naturally seem to do a lot of the activities that maybe are more physical and running around. And that it may not feel like an equitable workload to all people. Now, I'm not saying that your board needs to do certain things a certain way, but to pay attention to what your capacity is to do all activities and allow all people to be engaged is also important in terms of building your team and building an effective board collectively. So determining logistics, that's another must of site evaluation. So thinking about the timing of doing site visits and what other activities are going on for your board, right? So kind of a little bit of realism needs to factor in. Maybe not a little, maybe a lot. And coordinating any site visits with the mental health director or county liaison. I'm going to ask Julie and any other folks that want to chime in a second to go ahead and share with us what's that like, and do you do that? Are there concerns that have come up around site visits and the impact on client privacy, for instance, and how do you manage that, or how has that been addressed? Any thoughts from anybody who's on the call right now? And I'll go ahead and see if there's anybody with hands raised.
Well, I mean, we don't have a problem with that. We don't get client names. We don't go in. I mean, if we go in and, you know, there's clients out there, we may say, hi, how are you, you know, or a couple of the consumers that are on our board will actually sit down and have conversations with them about, you know, how they feel about the clinic and their therapist, or, you know, the problems that they see throughout the county. But for the most part, we don't have the interaction with the clients and consumers, and we never, ever get names or identifying demographics on them.
Okay. And I'm seeing, I'm going to go ahead and read a comment from Greg in Orange County. And he says, in Orange County, we visited several hospitals and care facilities with good results. We usually have a chat with the staff at the end of the visit where we gather a great deal of information. We've learned a lot about Welfare and Institutions Code 5270 from one of the sites, and offhand I'm not sure what that is, my apology. This leads us to have a public hearing on the subject, i.e. we've gained knowledge about an issue that was related to the community. And so it sounds like what both Julie just said and what Greg is saying is that it sounds like there's the ability to be doing a real open dialogue with staff that might be present, but that doesn't mean that there's any kind of confidentiality or HIPAA concerns that are rising up and doing site visits. Am I reading that correctly, Julie?
Yeah, you're right. And we're very open about it. At our board meetings, we, and I just sent you a copy of our site visit assignments. We will go over it. We'll open it. Okay, who's due, who's coming up, you know, that type of thing. And we volunteer for the sites that we want to go visit. So we're different, but because we have 4 boards that we actually can have people help do site visits. Because if it was just the main board having to do the site visits, then they wouldn't get done but once maybe every 3-4 years. The way we have it set up with the 4 boards, the regional boards will do some of the programs out in their regions, so that the main board is doing, you know, some of the other programs and services.
Okay, well, thank you. And Greg is writing in that their mental health director in Orange County will give us almost anything we need to do our job. We're lucky. Good for you, Greg.
Riverside's the same way.
and so, you know what, and that's something that, again, remembering all of the things on all of our plates, and remembering that we're trying to be building collaborative relationships, even it's really difficult sometimes not to get pulled into a feeling of that somebody is resisting what we're trying to do, but sometimes it can also be helpful to specifically give people information like, you know, in Orange County, or, you know, in Riverside County, I understand that their mental health board or their mental health director has a collaborative relationship in working with their board on site visits. And what that does is it gives your mental health director a point of contact. Oh, somebody else in my role does that. Maybe I'll contact them and see, you know, have them help me understand how boards go out and do that. So, you know, it's a learning curve sometimes for many people. And the other thing to remember too, and this isn't to give an excuse, but more to build an opportunity for you to have those collaborative relationships so that you can get your work done. There actually is quite a turnover going on in counties right now with mental health directors. So I know that in the Superior region of the state, I think there have been 6 counties that have turned over their mental health directors in the past year. So there's a lot going on. So doesn't mean that you don't have the right and the obligation to fulfill your responsibilities. There might be some context to know about, though. So let's all be supportive in looking for those collaborations. It looks like Burl has raised her hand again, so I'm going to go ahead and unmute her and see if we can hear from her at this time. And Burl, are you able to join us?
Can you hear me now? Can you hear me? I don't know.
Hear you.
It just doesn't seem. Oh, I can hear me.
There's a bit of scratching going on at the same time.
Oh, I don't know what that is. Well, I wanted to mention that for many years, we would our observation and checklist to the facility that we were going to make a site visit to. We would send that out ahead of time, and so that they would know what was coming, what we were going to talk to them about. But now we've actually, this is Napa County, we've actually streamlined send out a real questionnaire too. I think they like that a lot because they're able to really tell us some of their problems, some of the support they get from the community. And we always ask the question, do you have any other items you would like the health board to know about? And so then we get there, and we have an observation sheet, and they can see, I have a copy of that also. So they always know exactly what we're writing down and what we've seen.
Okay, and I apologize, Burl. I just now I muted you. What I wanted to let you know is that the listeners were letting me know that we're having quite a bit of static. It seems to be connected, just so that you're aware, when you're speaking, but when you stop speaking, it stops. So I don't know if it has something to do with the microphone that you're using or how close to the whatever you are. Maybe I can troubleshoot that with you offline tomorrow, so that you can be effective in participating in future webinars. And my apologies. So, but what I did hear, folks, from Burl is that her county uses some type of a questionnaire, and if I'm kind of extrapolating from the static, what I think I heard, it sounds like she also that they poll a site prior to going out on what they also might want to share, or what they might want to know as well about the mental health system. So again, good thoughts for creating that sort of a reciprocal relationship around the site visit. You know, we're coming to hear from you, but we're also coming and we're willing to give something back as well. So, you know, creating that reciprocal relationship can be really helpful. Okay. I hope I was able to capture what Burl was trying to share with us. So let's go ahead and move on, because I know that we actually have a sample site visit report, and I'm sure that a lot of you would want to see that. So let's go ahead and move on. So preparing for evaluations, and I'm just going to run through this quickly since we were just talking about many of these things. Assuring non-disruption services. That may be some of the trepidation that mental health directors have or that county staff may have. So assuring, putting that out there firsthand. When might be a time convenient so that we're not disruptive? We know the services you're offering are very important, et cetera. Assuring them up front. We want to make sure we're not impacting your HIPAA compliance at all. Is there any time that might be helpful? Again, bringing my own experience in working in a clinic, there were times when tours would go through when we were working on client files. So to have gotten that heads up ahead of time, and I'm not saying, I don't know who was responsible for that, but what I'm saying is that for there to be coordination on that so that there isn't any kind of HIPAA violation going on could be one of the reasons that people might be a little bit concerned. And so just giving that assurance on the front end is always helpful. Shows that you're aware of what they're doing on the job. Prepare or identify information gathering strategies. So any checklists that you want to have, any questionnaires, as Burl was saying, that you want to bring or send ahead of time, those are things that are great for preparing for the evaluation. I guess I sort of said information gathering strategies or evaluation tools, kind of same thing. So and Julie will look at this and say this looks pretty familiar, because look at it's here we go. I'll circle it with my cursor. The Riverside County Mental Health Board's site evaluation guidelines. And this is just a snippet of it, because for the purposes of getting it on the webinar, I needed to cut and paste so that it would show up and people would be able to have a hope of being able to read it. But see how they've outlined that there is a purpose and a goal. They actually have a guideline sheet that goes with their checklist. So they have a process and procedures about how they're going to do it. And one of the handouts, or actually two of the handouts, you would have gotten sent last night as webinar participants, in addition to the PowerPoint, were these sample sheets from Riverside County. And so, again, they'll be available after the webinar as well, so I can go ahead and shoot you copies of them. If you haven't gotten them yet, you can send me an email, and I'd be happy to forward them on to you. So again, looking at sample site evaluation forms. And Julie, I want to welcome you at kind of walking us through, if you know when your board created these, they always had the guidelines before the checklist, etc.
No. When I first, I've been on the board off and on since probably 2002. We didn't do site visits. It wasn't until I finally joined the CALM board and somebody showed me in the WIC codes what our duties and our responsibilities of board members were. There was quite a few things that I didn't know at that point. And once we found that out, it was like, well, we need to do site visits, because nobody had been doing them at all. So this actual form is, we took one that the CALM board had, we made it look a little more professional, and then once they found out that if they aren't doing site visits, they aren't doing what they're mandated to do, when Medi-Cal comes in or the state comes in to do, and I don't know how often they do their reviews of the different counties, we got dinged because we weren't doing site visits. We got dinged because we didn't have a Board of Supervisors member on our mental health board. Once you explain to the county that if we don't do these things, we're going to get dinged, they're all for it.
And I'm seeing on our chat box that James has volunteered. In his small county, he often knows people who are participants actually in the programs, and they'll often they will often seek me out, he says, and remind me of their names. He says we just have to be careful not to carry any personal information or impressions out the door. So that's a really great point for those communities that are either so small, or those services where you happen to walk in and you know people who are receiving services, being mindful of how you carry that information with you and not sharing that, that would be an inappropriate thing to do.
And also one thing I do want to point out to everybody, never, ever, ever do a surprise visit. That is the worst thing that you could do. You always call the contact person at the clinic or the program that you're going to go do, and discuss a time and a date that is convenient for everybody. Doing a surprise site visit is the biggest, fastest way to make an enemy, and you don't want to do that.
And one of the things you're all probably seeing on your screen right now is the fact that I've actually kind of moved around and how I'm doing the PowerPoint. And I'm doing that so that I could reach in and grab one of these forms so that you can see the full form right now. So here are the site visit guidelines, and you should be seeing them on your on the screen right now. Julie, are you seeing those on your screen?
Yes.
Okay. So here you can actually see the full guidelines that Riverside County has created. So selection of programs, scheduling the visit, just some things as simple as appropriate business attire, right? Along with an ID badge so that people are aware of who you are. And I like number 7. Number 7 is a really important one. Remember that you're representing the whole board. So you might want to have a discussion as a board about, you know, what do we say and what don't we say, right, when we go out, because you don't want to be out there giving, just like with any public venue as a board member, you want to be giving a clear and consistent message to people. And then reports. Do you want to talk a little bit about the reports that you're that are indicated in these guidelines?
Yeah, and I also want to mention that sometimes for board members, when it's the first time you've done a site review, it is perfectly okay for you to go in pairs to do a site visit. Or like I've taken new board members with me who've never done anything like this before, and you take them with you when you do your site visit. It's a way of orienting them to the process and the procedures and stuff. So if you're uncomfortable doing it by yourself, please go in a pair. And as long as you explain to, you know, whoever you're making the site visit with that you want to bring somebody with you because, you know, it's new to you, and, you know, that's perfectly fine. Okay, so you want me to do what now?
Well, no, I'll go ahead and I'll move on. So let's go ahead, and thanks, Julie. It's nice having you on because I know that what I've heard in when I'm out there and doing trainings with mental health boards and commissions is that it's always invaluable to hear what another actual commission or board member is doing. So Donna Matthews from CIMH may be wonderful, and I know you all think that I am, but certainly hearing from a colleague who's actually on the ground running just like you about what their experience is and how they're doing it just really can be invaluable. So I appreciate your participation. So let's go ahead and move on to the next one. And so here's, again, a snippet of the site evaluation form that they actually use. And I'm going to go ahead and do the same thing as before. I'm actually going to end the show and then pull up the document so that you can actually all see the full document. So let me just find it really quickly. There we go. Let me expand it for you. So here we go. Here's the site evaluation form that's being used in Riverside County, and so we see at the top they actually have a couple of different regions within their county. So that's why they have this section here with the desert region, mid-county, and western. They have the date of the site visit, who went, and you don't actually share this form, Julie, with your sites, do you? Or you just have this disclaimer on it so that people know what to remind people?
No, I show it. You know what? I have no problem showing it to them. You know, I tell them it's just a few questions that we have, and these are the questions that I have to answer, and, you know, so I will sit down with them in an office at first, and we'll go through the questions that they can just answer verbally, and then we'll go around the site, and they'll show me.
Great. And so let's all just glance down this. I'm going to shut up, and I'm going to just go ahead and kind of scroll slowly through the 2-page document and let you see it.
And Donnie, they don't have to answer every single question on the form. This is just a guideline that you use so that you don't miss some of the things that may be important to you or to the other members of the board.
So I want to stop here, and I want to point out one thing that, you know, at the beginning of the webinar, we were talking about the functions of mental health boards to review, evaluate, and make recommendations on how to improve services. So some of the information, whether your county board adopts a similar type of format or you come up with your own checklist, looking at questions such as how does this program implement the recovery model? Or let's see, there was another one that I saw up here that was kind of interesting. Does this program use consumers and family members in the delivery of services? So you can have, I mean, these are examples of things where, depending on what the answers you're getting, could prompt certainly not punitive. You'd never want to make a punitive kind of recommendation, but where you can make improvements based on changing the characteristics or enhancing the characteristics by which people get services, right? So if, for instance, you have a community outreach program or a mental health clinic that serves transition-age youth, and there aren't transition-age youth peer advocates, maybe that might be something that becomes a potential recommendation. Kind of the world is your oyster, so to speak, right? That expression. You have your ability to, based on your perspective and in your role in serving the community, to really think about what might enhance even already good services. And I think that these are two critical parts to the form that Riverside County is using, but that I'm sure many of your counties are thinking about and consider, is what's the overall impression of the survey, or overall impression or very brief summary. As you're walking out the door, what are you remembering most about that place? And what would be your recommendation around program needs? Help them with the signage, as Julie said, so that people can find them. Or is it something about, you know, creating or increasing the different types of staffing that they have so that people are served more effectively? Okay, so again, those are forms that are available to you along with the PowerPoint. So don't worry about being able to not have scanned those forms as quickly as I was kind of skimming through them. Okay, so after the site visit, and this is an excerpt from the guidelines that Riverside County had used in how to use their form, but it's also something that many boards are factoring in already, right? About after you do the site visit, it's not just so much just doing the site visit. How are you going to bring what you gained back to your board and back to your community? What are you going to do with it besides making recommendations? And so we see here that Riverside County is suggesting to use that report form, fill it out as you're going, and emphasizing the key aspects of the program. But also, the second one is clearly critical, that you need to be thinking about how you would present your review at one of your board meetings. And during your verbal report, making mention of some of the minor details and nuances of the program, that it doesn't have to be sterile, so to speak, of all the personal impact of that program. It doesn't have to be too regimented. And also thinking about the verbal report as imparting a basic understanding of the program, even if someone doesn't see your checklist. Okay, I encourage us all to just take that big stretch break again, and we'll proceed with how to establish a work plan. But before we go on and during our stretch break, I want to go ahead and open it up again for how are people doing? How's it going for folks? Let me see if there are any questions. I thought I saw a question, but perhaps I didn't. Okay, and can I see a show of hands if people are feeling that they wish we could spend more time on site evaluations, or if you're ready to move on to a work plan and doing the annual report? Yeah? Are folks ready? James is ready. Okay, I see other people are ready. Okay. All righty then. Ready to move on. Thank you, April, up in Sierra County. Okay, so moving on. Creating a board or a commission work plan. Okay, these are your components of a work plan, and this is a suggestion. Again, because you're operating as a collective team and you're not an individual, we all have our own individual idiosyncrasies or ways of getting things done. We don't necessarily need to document it, right? But as a collective team, it is really helpful to have some type of mechanism. That's why we keep minutes. That's why we take notes, etc. Some of the components of a work plan are, and I've bolded the ones that are probably the ones that we're traditionally thinking about, are who's going to do the work, what's the work going to be, and when are we going to get it done? But what else is an important component of a work plan? Also important is thinking about what we were talking about before, the capacity, right, of our board or commission to do it. What's the logistics behind what it is we're trying to do? Let's really think about what it's going to entail before we commit to it. Not that we shouldn't commit to it, but let's just think it through. And what else is needed? What else do we need? If we want to go out and do some site visits, but we haven't even looked at some of the reports that have been done on a particular facility, or if we're going out and we're looking at, oh, I don't know, you know, a clinic that, or a counseling center where youth and families are being served, but we haven't looked at the needs assessment report that was done the prior year as committee members or as board members on what the needs of youth are in our community, might be kind of a helpful thing to do first. So identifying what else is needed. Maybe we need to do a request of staff to provide us or to inform us if there are certain reports that might help us or inform our site visits. Thinking about what else is needed. And then 6, why are we doing what we're doing? So thinking about that who, what, where, when, how, and why. Who's going to be doing the work plan? Who's going to be doing the different activities? What are the activities going to be? Where are we going to be doing it? What are the logistics? When are we going to be doing it? How? And then why? Let's always relate it back to, again, those roles and responsibilities and our board goals. Whoops. Sample activities in a work plan. If we think about sample activities that would be in a work plan, it might be conducting our public meetings, right? We have to do those. We want to do those. Those are part of how we conduct our business. So that would be a real critical part to our work plan. Annual meetings and retreats that we might have. Needs assessments we might want to conduct or attend. Participation in committees. Some of us serve on committees in the mental health department. We may have our own board committees, etc. The evaluations and the site visits that we were just talking about. How are those part of the work plan as well? Attending community events. Part of our outreach may be to make sure that we're outreaching to those communities that are underserved or that we haven't heard from or that we don't have data about. Equally important. And meeting with the mental health director. Apart from your board meetings, your chairperson is required to be in communication with the mental health director. Now, that doesn't mean necessarily meeting with them physically, but somehow meeting, communicating with the mental health director. When and where does that happen and who does it? And Board of Supervisors meetings, do those factor in? Are we planning on presenting at them? Are we attending them? What are we doing around that? So those are all activities that may be in a work plan. So thinking about those things comprehensively as a full board really helps to then set the context for a work plan and figuring out how to prioritize. So types of work plans, when we think about it, could be narrative, just thinking about all the different things that we want to do in a particular year. Some people, I was at I was doing a board training in a county, and they just took out some flip chart paper and they put 12 sheets up on the wall, and they put a month at the top of every sheet, and they started plotting out what they already knew they needed to be doing. And then they stepped back and they started thinking about how they needed to rework it because certain months were loaded up with a lot of activities, etc. So work plans can be very rudimentary. They can be very simple. It doesn't have to be complex. It's whatever will work for your group. Another type of work plan might be a timeline. Timeline is usually a linear diagram where you plot things out chronologically according to how you think they're going to happen. Or a matrix is another organizational document. So here's a sample work plan, right? I put this together last night, thinking about if I were in one of your counties, how might I, mock up a work plan? So again, keeping it so simple that anyone could understand, right? And that we can have easy communication on our board about what it is we're doing, what we're plotting out, and how it's going to all flush out. So thinking about who's going to be doing the work. What is that work? Here we have a work plan for site visits. Where is it going to be happening? When do we think it's going to be happening? And maybe we don't know the specifics for everything right away, but we start plotting it out. We start giving ourselves a method for seeing where the gaps are and what we need to fill in. So any questions on this offhand? Okay. Let's see. So I see from Lynn that I don't believe our board regularly has presentations about program reviews. Is this required? Lynn, it's not required. However, your board can definitely, depending on what your goals are, be making requests. In general, many boards will have a mental health director's report or have different staff that have time on the agenda for standing items, for instance. But usually it's your mental health director. That report might be about anything. If you would like that report to include certain programmatic presentations, your mental health director might provide that, or they might enlist a staff person to give you a report out on that program. But that would be something that in setting the agenda, your chair could communicate with your mental health director and see how you can schedule that so that you can get those needs met. So it's not a requirement, but to the degree that your board needs certain information, it's well within your rights to request that that be scheduled. And then you'd want to, again, in the spirit of collaboration, make it logistically an easy time for that staff member or that director to be able to bring you that information. If you're requesting information that takes a lot of work to collect, you might want to be flexible about the timeline for getting that sort of thing. Okay, so let's look on. Evaluating the work plan. Once you have a sample work plan, is there the capacity on your board to carry out the activities? Does it make sense? You look at it and you go, Miguel, let's see, we'll go back. Gee, Miguel's doing everything, or Miguel, Sharon, and Fatima are doing everything, but we've got 9 people on our board. What are other people doing, right? Doesn't mean that other people aren't doing anything, but we just want to start thinking about are we sharing the load, so to speak? And how are we maintaining our wellness during it, right? We see here that the site visits are actually spread out. They're not like right on top of each other, and one person isn't doing them all. So it seems like it's a reasonable work plan looking at this and not knowing what else is going on. And how will the board share the results of the site visit? We've talked about that already, but that always needs to be, it's an important thing to be mindful about so that that gets on the schedule as well. So looking at this, here, we see we've just added that. We had this whole matrix made up about our site visits, and then we added a column. Here's when we're going to report back to the mental health board. Makes it really clear, really simple, and you start to develop a system that then makes it easier because it's not new every time for folks. And then, oh my goodness, look at this. Expanding the work plan to reflect all of the board activities. So suddenly now we've slipped in chronologically that Ron is in here and he's attending the finance committee meeting in the county administration building in order to update the mental health board about what's going on with the county finances. Or Doretha is chairing the mental health board CIT committee, right? So you can keep your work plan simple around certain tasks, or you can actually use them and expand them to reflect all of what your mental health board is doing. Now, developing the annual report. So let's see if we have any questions before we move on to the annual report. I'm not seeing any hands raised, and I'm not seeing any additional questions, so we'll go ahead and move on. So developing the annual report. Practical tips for developing the report. Oh, number one has always got to be that designate who will do the report early on. If anyone remembers those days of being in school, or if you're still in school, or if you're going back to school, I went back to graduate school a couple of years ago, and boy, what an awakening. Remembering about the importance of setting goals early about when to get things done. Takes a lot of pressure off in terms of going, okay, so now I need to start planning. Who's going to do it? How's it going to get done, etc. Also, in addition to just deciding who's going to do it, whether it's going to be the chairperson's responsibility or whether the full board can take responsibility, is developing a template. Let's figure out what an annual report needs. Let's develop the work plan. Let's actually do a little work plan for doing the annual report. So we get it all plotted out. We know what needs to happen when. Creating ownership of the annual report, it can be really important. Oftentimes I've heard about mental health board chairs staying up into the wee hours of the morning trying to put something together based on an entire year work of an entire board, and feeling kind of out on a limb by themselves. And there's really no reason to do that, because your boards and commissions are doing such good work, and they're doing so much community engagement and evaluation and thinking about how to make improved services, that it is really important to allow the community to learn about that and to be valued for that work that you've done for an entire year. So we're going to look at how we develop templates and work plans to make that easy for you all. And remember, the report doesn't have to be fancy. I'm going to show you a sample report a little bit later, and it's pretty, you know, but it just needs to really, the report is about the content of what's in it. It needs to show that you've done your review, your evaluation, and that you've made some recommendations about how to improve services. So sample components of an annual report, state the goals and objectives of your board for the year. Start with that. You know, that's an introduction. Provide the basis of your board's activities for the year. Maybe you have some goals that were carried over from the prior year, or you are aware of the results of a needs assessment that was done the prior year and you're moving forward on them. Whatever it is, provide the basis for what your activities are going to be for the year. And then provide a description of the activities, whether that's committee participation, you know, someone's on the finance committee, someone else is on the CIT committee, or you're looking at the children's services system, or what have you, right? Provide a description of those board activities and any findings that come out of those activities. Again, more sample components of an annual report is that it is the focus of review and evaluation for the year. And it can highlight the exemplary practices or services that you've seen, and also include those recommendations. Now, as we've been talking about, let's use the example of the site visit. We've discussed how you do a site visit, you can generate a checklist or a report, and then you're actually going back to your board and you're doing a report out, which means that it's in the minutes. And part of that report out is including recommendations from that site visit. By putting those prior things in place and documenting them at every point along the way during the year, the notion of doing an annual report can become, in fact, the compiling of information you've been gathering all year, and it can make it much simpler. Doesn't tax anybody's memory banks because you've been documenting it along the way. Again, sample components of the annual report can state the goals and objectives for the coming year. So you're done with this particular year, but you're already looking ahead. You may give an indication about what your goals and objectives are likely going to be for the coming year. Personal success stories from service recipients make the annual report more real and meaningful. This can't be underscored enough. How many of you have read reports and you're just like, oh my goodness, is this based on anything? You don't get the actual picture. There are times when reports in general feel so dry and devoid of the people that are actually being served if we're looking at services and programs. And so to actually include, doesn't need to divulge personal information like names or other identifying information, but to give a personal success story about, you know, at XYZ clinic, you know, they've seen XYZ amount of people, and of those, there's a 90% rate of youth of youth completing the youth leadership program that they've instituted. So it doesn't even have to be a negative slant or a deficit-based approach, but rather framing things in a positive light about what's working. What has your board seen or been involved in that's working in the community and in the county? And remember that multiple viewpoints can be held and documented. And providing the rationale in those kinds of situations can be important to support each view. So in other words, as a board, you may make certain observations on a site visit, and yet other reports might yield other information about services. You might want to address that in your board report. You don't need to skirt that there is differing information about services, but you might want to set a context for, this is what we found when we actually went out to the site, and this was what the report had said about the availability of services, and we might have found otherwise. That can actually be quite eye-opening for your community. Okay, I'm going to pause for a second and see if there are any questions or anything. Okay, we're going to keep going. So a sample annual report, again, I actually clipped a table of contents, if you will, from someone's annual report. And this is the one with the pretty cover that I mentioned a moment ago. They had an introduction, right? They actually gave, and they had a little introduction that introduced people to who their mental health board members were. They had the chair do a little forward, just a little, you know, one-pager at the most, talking about, in general, what the experience of the board was. Special highlights, did a section on special highlights where they had asked the mental health director to submit a report for insertion. They looked at the Mental Health Services Act steering committee and programs and wrote an update on that. They included some data that the staff had collected for them about system performance and outcome data. They looked at mental health services and outcome measures. This particular report also included committee reports. So there are board committees. They had one committee that addressed adult treatment and recovery services, and et cetera. They included summaries of those committee reports. And then they also, they didn't, actually this particular annual report did not include site visits. They did not call out site visits in particular, I'm not sure why. But this is, so I inserted some sample ones. So say you went to the Hmong Women's Clinic and you went to the Wellness Center and La Familia Counseling Center. Those are some of the site visits. You might insert with that a brief summary about the highlights of that visit and if there were any recommendations. It might be something as simple as a paragraph describing the services and then a couple of lines stating recommendations. And again, those recommendations can be relative to anything that impacts people's ability to access helpful services. There might be featured reports that you've received as a board that you want to include that are relevant to the work of your board. Maybe the correctional mental health team has generated a report. Maybe there's something else. Maybe you've developed a checklist for examining room boards. Those are things that you could include. And then you might throw some stuff in an appendix. Bios about your members, the different committees that meet, your mission and your values and your vision, and maybe your supervisory district map. So these are things that you can put in an annual report, but again, what you want to do is indicate in your report how you have executed your statutory obligations and responsibilities to review, evaluate, and make recommendations. And then after the report is completed, you want to think about how do we disseminate that report. Now, this is not normally talked about. I think that normally your board, your mental health departments, most counties will post them on their website, and that's a very helpful and very typical way of disseminating your report via the website, because it's very accessible. However, you might want to think about the report. You might want to think about people you've talked about or programs you've talked about in the report. You might want to look for ways to impart those in unique ways. You might have in your meeting after your report is completed and you've approved it and it's been approved by the Board of Supervisors, you may have copies available at your mental health board meeting, right? To actually make it more accessible, show that you're reaching out to folks. You probably, I'm positive you can't print enough for your entire county, but and that's one reason for putting it on the web. But think about how you might disseminate the report, because again, your community wants to know how you're executing your duties. Also, tips for presenting to the Board of Supervisors, should you want to do that. All important is a courtesy notice to the mental health director prior. And this is not just regards to bringing your annual report there, but because the Board of Supervisors is your mental health director's boss, in essence, that it's courtesy, and because both the mental health board and the mental health director are both working in tandem at meeting the mental health needs of the community, it's courtesy to notify each other when you're going to be going to the Board of Supervisors. Again, if you're going to be presenting to the mental health board, communication most effective when you speak as one voice. Even if you have differing opinions about things, that can still be multiple viewpoints or multiple issues can be raised using a unified voice. And advocating for what will make things better, stronger, more effective. That's why in your annual report, when you've gone through your section on explaining what you've reviewed and evaluated, you include recommendations, because it's not enough to evaluate that something is not working. You want to then be proactive and say, and yet here would be a positive step towards improving services. And knowing what you want to accomplish as a result of advocating if you're going to your mental health department. If at the end of your report there has been a crucial issue that has been raised in your community that you've addressed or you've investigated and you want to share the findings from it, really makes sense to kind of have a clear plan as to how you're going to present that information to your Board of Supervisors or to anybody and to any public forum. And to develop and demonstrate in your report as well those partnerships that you've made that have empowered you to do your duties. Okay, and then of course being respectful and courteous and looking at ways to demonstrate that you've been acting in good faith on behalf of improving services for your county. And that's what your role and what your activities have been based on. Okay, and here's that pretty report I was referring to. Kern County has a really nice report that they did. I would probably add the site evaluation section to it if I had been, providing if they had done site visits. As we all talked about before, not all counties have been able to do site visits. But I've gone ahead and provided you with the website link so that you can access it should you want it. And here's just a cover of their report for 2010. And let's just take a minute now and talk about, out of all of the information that we've just been kind of rolling through here on both site evaluations as well as work plans and writing the annual report, what are your thoughts in terms of your mental health board and in terms of how you envision things in your being able to execute those duties in your county? Are there questions that you have about how you can bring this information back to your board? Or any comments? Making sense to folks? Okay. I know it's late. Okay, so let's go ahead and go ahead and wrap up. I'll move into the wrap-up mode for us. Let's see. So one of the things to think about as we begin to end, and I'm just putting this in a little bit early so that you don't forget it, to please complete the short pop-up evaluation as we end the webinar, is to think about as we move on, and I've mentioned before the co-occurring disorders webinar, part of what will make our webinars more effective for you is if you have particular questions that you would like answered or particular needs that you would want addressed in particular, or for me to integrate into presentations, I really welcome you contacting me directly through email or phone and sharing what your needs are so that we can make sure that those get integrated into the presentations that we might do in the future. And I see our hand raised from Lynn Fuller, so I'm going to go ahead and unmute her. And Lynn, did you have something to share with us?
Yeah, I actually put a question up there. I was searching our mental health board's website while you were giving your presentation about annual reports, and it doesn't look like we do them. I mean, I searched the word annual and I searched the word report, and I don't see one. I don't remember ever working on one. So we don't do it, and I wonder if I should bring some selling points back from this webinar on initiating that. And if so,
I definitely would, since it actually is a statutory requirement. Now, I'm not saying that to be shaking a finger at your county by any means. There are many counties that have lapsed in doing annual reports or go through cycles. And in part, that may have to do with who's your chairperson, what's going on for your board, what the history has been. So it's not about looking backwards, but rather about looking forward. So I would encourage you, Lynn, to definitely make your board aware that this is an opportunity, and especially with the realignment of services and with the authority of DMH not being the overseer in plan approval and that sort of thing, the annual report becomes your document for going on record about what your board believes your community needs. So I would strongly encourage you to do that. I also want to, Lynn, what county are you with again? Do you mind me asking? And you,
no
what's that?
San Francisco.
Okay. And this goes for everybody actually. You may go to your county website and you may not find your county your annual report for your board. I would not assume that that means that your board has not done one. Although if you don't recollect it doing it, I believe you for sure. But what I would say to you is that some boards have done reports and they just haven't gotten posted, or they've done reports and they've since kind of sifted off the page, so to speak, on the website because they haven't done one in the past couple of years, but they actually had a history of doing them. So you may contact your county liaison or your executive director if you have a director of your board in some of the larger cities or counties, and actually ask the question. I'd be hard-pressed to think that San Francisco had never generated a report. And so I would really err on the side of assuming that there's probably some sort of documentation for most of your boards, even if it's not current. So go ahead and try that. Let me see. Did you have any other questions? Okay. Let's see. And James is sending me a very nice little message stating, I would be hard-pressed to pick out the best thing I learned this evening. This has been thought-provoking and inspiring for me as I serve in the future. Thank you, James. It's very nice. And April is, let's see, then there's a comment. I'm not sure how large Kern County is, but it would be helpful for Sierra County to see an example of a county's annual report from a smaller county. And, you know, April, that was a great comment, and I will go ahead and do my darndest to see if I can find some additional samples. When and if I do, I will send them out to the group that participated or that registered and for whom I have emails. So you may not see that immediately, but I would say within the next week or so, I will definitely look for some of those examples. I'll also go ahead and, as I just mentioned to Lynn, that there are definitely some boards that have done reports. They're not on your websites for whatever the reason, but I'm privy to some stuff. Just from my work in counties, and because those are public documents, I'll go ahead and scan things that I do have. What I want to underscore is, again, the imperative to not get hung up on the professional look of a report, rather to focus on simply documenting, even if it's in a 3-page document, about what your goal was for the year, what your activities were, and what you reviewed, evaluated, and what your recommendations are. So again, not making it feel like it needs to be the cat's meow, so to speak, or that it needs to be the best of the best reports, but rather that it reflect clearly what your board is doing. And I want to underscore that what your board is doing may also be things that are not traditionally thought of as being in a report, but that I think are completely ethical uses of your time and of your effort to represent your communities in doing the review and evaluation of services. And that includes things like your own board infrastructure development. So if you are a board that has, if you're in a small county and you only need to have 5 people, but you only have 3, you're probably going to spend a lot of your time that year trying to find additional people for your board so that you have a legally constituted board. If you're in a large county, similarly, you may still need to be doing recruitment. That may become a very important and valuable and critical goal for your board. And so don't leave out those things that show the community really what it is you are doing. Alrighty, so let's see. Other thoughts? I see that there's another comment about should the annual report be a bylaw requirement? You could put it in your bylaws, but it's in the statute, which trumps your bylaws, because your bylaws can change. The statute requires that you be doing an annual report. So I would feel well within your right, and that's why this webinar, that was another question that just came in, by the way, about whether that should be a bylaw requirement, the annual report. And so you can feel comfortable pulling up the information at the beginning of this webinar on those first couple of slides and looking at the statute requirements and using that as your foundation for why you need to do a report. So I would feel, I think that you have ample tools for that, for making that, for advocating for that. Okay, I'm going to do a quick scan, and then I think we're going to close up shop here. I don't see any more hands raised. I'm going to go ahead and look at our questions box again. Make sure I haven't missed anybody. All right. Let's see. Left. Okay, so, and Lynn did say what our mental health board doesn't do an annual report. What are the selling points for doing one? And again, I would flip to that comment we just had about the annual report is a requirement by statute. So you need to be doing that. That would be the selling point. That is part of your statutory requirements. As well, though, as creating transparency in your community for proving that you're doing your job and that somebody is overseeing services on behalf of the community. So, okay, let's go ahead and I'm gonna, if I don't see anything else come in the next second or two, I'm gonna go ahead and move on. And so again, here we are on, please join us for the next webinar on co-occurring disorders on Saturday. And again, these times were selected at the recommendation of the CALM board, which CALM board, as a reminder, is a statewide association of your local mental health boards and commissions. Julie Crouch from Riverside County, who was on earlier speaking about her site evaluation forms, is one of the members of the CALM board. And that's a board that directs me on some of the topics that it's comprised of 25 representatives from 25 of your counties across the state. And they are always kind of on the front end of looking at what are the burning issues in counties. And so they serve to be my vetting body for the work that we do in these trainings and how we set our training topics. So just as a reminder about who they are. So finally, a big gold thank you to you all for hanging on with me until 7:30, and it looks like it's 7:30 on the dot. I will open up my question panel one more time to see if there are any final thoughts. And otherwise, I would encourage you, as you close out of this webinar, please do complete the evaluation that pops up. It's only 6 questions long, I believe. So please do answer it. It really helps us to know whether or not we're doing a good job. And I bid you all adieu because it looks like we have no more questions or hands up. Okay, good night, everybody.